Okay, hey, we're here with Lyle, and Lyle, we've been doing some decompression therapy, have we not?
Yes, we have.
What's the background with your low back?
I had my first back operation in 1970 as a senior in high school. Had the second one 3 years later. Nobody knows for sure what caused it. The first one possibly was an incident on a dirt bike, and it didn't show up for about 6 months. The second one was just getting into a car to go to work one day and slipped another disc. And then 6 years after that, I had the third one.
So you were in high school, is that a couple years back?
Not that many, it was only 39 years ago.
Okay. So earlier this year, you had the symptoms got bad again?
Yeah, I was having a real battle. My back, I was having severe pain down the right leg. Not the back, not the sciatic, but when it runs down the inner thigh.
Right.
And it got to the point where I couldn't do anything. I couldn't lay down, I couldn't sit down, I couldn't stand, I could hardly walk. So yeah, I got pretty bad.
Okay. So you were trying to avoid the drug, any intervention with that?
Yeah, I didn't want to go to a pain management type person because I know that they can go in there and block a lot of that, but then I don't really know how my back's doing.
Right.
So I'd rather that I avoided any treatment like that so that I know exactly how my back feels and know if it's getting better and when it's getting better.
How was the therapy for you? Was it comfortable?
The first, I believe it was 6 visits, might have been seven visits. Weren't very comfortable, but that's laying down for me at the time was about one of the worst positions I could be in.
Right.
Whether it be in my back or my stomach. And when I laid down, I got the severe burn down my leg. And so the first 6 or 7 visits, I believe it was the 7th visit, that just kind of disappeared.
Right on, right on. So how's your activities now? You like to golf?
Yeah, golf at least once a week, sometimes 2 or 3, depending. Sometimes I feel like if I start to feel the nerve a little bit, I'll come over and go through a decompression session. I've just went through one today. It's the first one I've had in, I'm not really sure, you could tell me, 4 or 5 weeks, I think.
Right, right.
And then I had one probably 3 weeks before that one. And it just seems to keep it in line. I have an inversion table at home, which I do every morning.
Good, so it's a good conjunction to use with that.
Right. But if I feel like it's getting out of line and the inversion table's not doing it, basically by the feeling of the nerve, then I'll come over and go through a decompression.
Right.
And so far, one trip has done it.
Wonderful. Yeah, because your CT scan was, it wasn't unusual, was it? You had actual scarring around?
A lot of scar tissue.
A lot of scarring, so that makes it very unusual, and we see some very nice results for it, huh?
Yep.
Very good.
Terrific.
Wonderful. Well, thank you very much. Anything else to add?
No, don't think so.
All right. Thanks so much.
You bet.